All right, Bob. Good to meet you.
Hey,
Good to have you here.
This is awesome.
I'm excited to have you. So this is our inaugural podcast.
Yeah.
First one for Enterhealth. Excited to have you here. You've been a long-term partner for Enterhealth over the years. We're going on 17 years.
Wow, that's incredible.
Yeah, it's been a great journey, and the ticket's been a part of that really from the beginning.
Yeah. No, it's been fantastic to represent you guys, and love the number of people that you can tell like it affects, and the results that happen over the course of time. And we were talking the other day, and this is kind of what we do is we get together once in a while and give you guys a chance to tell me what I could do better, and I sometimes we're both in our own individual worlds, and so we got our tunnel vision, and you're doing your thing and I'm doing mine, and so it's good to kind of check up on the old radio relationship if I'm going to do like commercials and be the voice for you guys at times. Then it's important that I know what the heck you guys do.
Yes.
That's a real key.
Yes,
is
absolutely.
know what you're actually representing. And so, yeah, I think it's great to, go grab lunch or something. And in this particular case, when you guys are doing a podcast, it just makes sense that we almost have our lunch conversation in front of mics. Maybe somebody's into this.
No, I couldn't agree more. And, we've got to know you guys over the years. And I feel like even though we are kind of in our own little circles, we're really community-based.
Yeah.
The ticket's a big part of the community, a lot of listeners here in town, and Enterhealth was really built for the community.
Right.
And that's really the purpose. It came from very humble beginnings. And so I think we kind of share a lot of those common traits together. But with this podcast, what we're trying to do is have real, authentic discourse around a subject that I think is coming much, much more into the public light. But it's complex, and it's touchy, and it's sensitive.
Yeah, it is. And I would imagine in an ideal world, a spokesman or somebody representing you guys would have their own backstory, which is why I kind of stopped you guys the first time we met and said, look, I don't know anything about this field. And you guys, of course, were fine, once I got up to speed with things. But just to be real, there are times where, I'm representing somebody and I, actually deal with what they do all the time. And then there are other times where I'm like, yeah, I'd love to partner up, but I should probably figure out what is it exactly you guys do, because I'm going to get asked. And then I'm going to either have a good answer or I'm going to completely shrug. So I get, obviously the overall thing, but I think it's key for people to kind of know what you guys do, and maybe even more importantly, how you got to this point, kind of the origin story of, how does one even start something up like you did?
Yeah, no, I think that's a good place to start. I like to tell people I'm really in it by accident. I used to practice law.
Yeah.
I was a corporate and tax attorney, so I call myself an attorney in recovery,
sure.
if you will.
Yeah.
And after I'd practiced for 3 years, I came and joined our marketing company, which is called The Point Group. It's our family business.
Yeah.
And through that relationship was introduced to a real pioneer in the field. His name was Dr. Urschel. He was looking to do some work with us at the time. And, over the course of about 18 months, our team, working with him, got to better understand really what the addiction and mental health field was all about. Fortunately, I hadn't had addiction in my primary family. Mm-hmm. But, over the last 17 years, I've realized there's really only like a degree or two of separation when it comes to this issue.
Yeah, pretty much for everybody, right?
Pretty much for everybody. It's honestly the best cocktail party opener.
Yeah.
Because as soon as I start talking about what I do, people want to talk to me about what's going on. And I'm happy to talk about it because I'm pretty passionate about what we're doing. But about 17, 18 years ago, we started working together. And what started off as really a marketing assignment with Dr. Urschel turned into really about a 2-decade journey now. We had a close family, actually a couple of close families to my parents, people that I knew that had lost 2 children to substance abuse, one to suicide, one to alcoholism. And it was interesting to go through the process of watching the family try to get the help they needed for their loved ones.
Yeah.
Searching desperately for answers, then watching the tragedy unfold right there with the family losing 2 children. And I tell people that story because I felt like it was a catalyst for us really getting involved. Because it wasn't something we knew a lot about. I mean, when you say, look, Dave, I don't know a lot about the field, I was sitting in your shoes about 18 years ago. I didn't either. But I learned real quickly that there's a huge need in this market. And so we started off, I like to tell people, it was humble beginnings. It really wasn't. It wasn't a grand plan. It wasn't, let's go raise a bunch of venture capital or institutional capital and go build something to try to sell it off. It was, there's a need. We have the ability to pull this together, both operationally, financially, but most importantly, clinically.
Yeah.
Had a great lead doctor we were working with, and we saw the void in the market, huge void in the market. I like to tell people, even though I'm not necessarily a healthcare clinician, but the industry in general is pretty broad, but the addiction field is always looked at as sort of the redheaded stepchild of the field. Mm-hmm. And I feel like over time it just hasn't had a lot of the attention that it needs in terms of professionalism. And
why is that?
You know, I think a lot of it has to do, I think there's been a lot of, perception around addiction. I think people view it as maybe a moral weakness, a sin, something that you can just kind of shake off, if you will.
Yeah.
And hasn't ever really been viewed credibly in the medical community as a condition you can effectively treat. And because of that, I think it just, the people that go into the field, historically, there's a lot of great people that practice in the space. But generally speaking, you had a lot of people that had been in recovery, going into the treatment of recovery, trying to help those, and not a lot of real professional discipline around it. I'd say a lot of maybe a lack of training, a lot of real lack of medical intervention there.
Right.
Where, I used to get the question in the first 2 or 3 years that we were open as, well, where are the doctors? And I thought to myself, gosh, that's an interesting question. Where are they?
Yeah.
And this is a medical issue that can be treated, so where are they? So, going back, those were kind of the original thoughts were, look, this is something that's affecting families all over the place, and it doesn't discriminate. You're talking families that have the means to send them their loved ones anywhere they'd like. So they couldn't find it. So let's try to build something that we can be proud of and do it for the community.
Okay, so there's a couple things here, and once again, I think it's important for me to reiterate that I'm a bit of a caveman on this. If you want to talk NFL draft or the NHL playoffs, I'm more than equipped to do that. But in this space, like so many when we're on the air, and luckily I work for a station where we do dip our toes in waters where we have no business going. It's just we claim curiosity at times. We might just be idiots, but when I hear this, first of all, I want to be careful, but at the same time, I also think probably like the normal person does think about these topics forever, which is first of all, recovery is sometimes labeled just as like rehab or something along those lines. I definitely feel like, terms are terms, but I don't think Enterhealth necessarily wanders down that path. Really, it's you talk about recovery as a different thing, right?
Yeah, no, I think it's a great point. As you get into this space, there's little terms of art, if you will.
And societal shorthand is not necessarily what you guys
exactly, yeah. and that's one of the points we've tried to just make across over the years is we're really focused on treatment. And when I talk to families or talk to people that have a loved one that need help, I try to explain to them there's a lot of places you can go If your loved one needs help, you can go to a hospital and they're going to stabilize you, but you're probably going to be back out in about 3 to 4 days.
Yeah.
And then you're going to be in an outpatient level of care. And there's nothing wrong with those paths. We've just felt like what's really needed is true treatment. And true treatment is a little complex for a complex illness.
Yeah.
You've got a lot of things going on with someone that's suffering from addiction at this level. If they're needing to go into treatment, which is what we provide, it's complex. You've got a multitude of issues you've got to deal with. You've got mental health issues that historically have not been addressed, actually, in the field.
Yeah.
That's why I say the question, where are the doctors?
Right.
You know? That's where the doctors come in, because they're assessing what the term of art is dual diagnosis, but what does that really mean? What's the underlying issue that's going on with patients? Because not everyone is just born wanting to go, use alcohol excessively or use drugs. So what's going on here?
Yeah.
The dual disorder really allows you to get in more into the psychiatric realm.
Okay.
What's happening? And it's on a spectrum. Most of the time you're dealing with excessive anxiety or depression. And sometimes that innate feeling of not feeling well or like yourself, like you want to be, is what precipitates you to want to go use. You create this altered state.
Yeah.
And so by being able to address more of the psychiatric issues and then bringing together the therapy, which is absolutely instrumental in what we do, I like to tell people that the doctors play a very, very important role, but the vast majority of what we do is really therapeutic. Because we're complex. We all have our own lives. We have our own ways of navigating to where we are today.
Right.
And oftentimes there's family strife, family issues. There could be trauma-related issues, on a whole spectrum of trauma. Some very, very severe to some that are minor, but in their own mind, those were traumatic situations. And so being able to work through those issues therapeutically, medically, and then we'll get more into it, I'm sure, today, but really, how do you wrap around a program like that to deal with it effectively? That, to me, is treatment.
Yeah.
And with effective treatment, people get better. And I think there's this misnomer out there that if you go to, quote, rehab, you're almost better off flipping a coin than you are going.
Right. Yeah, it's interesting because oftentimes it feels like over the course of time, Dave, just like the mental health aspect is it's almost trying to get everyone to acknowledge it's a real thing, which is hilarious in a sad sort of way, looking back over decades where, even. And I forget whose marketing slogan that it was originally, but I when I started hearing people say like it's okay to not be okay or something along those lines, I might be butchering that, but that one resonated with me in the sense that if you have a problem, well, just stop doing it and toughen up. And all these things that we were all born with, right?
Exactly.
We heard from our dads and their dads, and so like the alcohol and the drugs component have been here for generations.
100%.
But the ability to like recognize and even acknowledge that there's underlying circumstances here that are driving us in a certain direction, like that almost feels like we're just scratching the surface of the newness.
I kind of agree with you. I feel like this is maybe the next frontier of healthcare, if you will, is really getting into understanding what's going on with mental health. Addiction, historically, addiction and mental health have always been separated. I think it's mainly for insurance purposes or whatnot to categorize them that way. But it didn't take me a week once we had started all this to realize addiction really is mental health. You're dealing with mental health issues. There just happens to be a substance use disorder going on. And as time goes on and medical communities evolve and there's more public attention to these issues, I feel like it's getting its day in the sun, if you will, around it. It's time to look at these issues. I even feel it just from a political standpoint right now.
Yes.
You can feel it with post-COVID.
Yeah.
A lot more attention to mental health issues.
Yeah, it feels like society has almost forced us to acknowledge these things. So I don't want to talk about positive ramifications of chaos, but our phones. And we talk about this all the time as parents. Our kids we're now to a point where our kids know no other universe. And so I don't know if us Gen Xers are the last frontier of people that actually remember life before we had a phone addiction and a screen addiction. But what I think that helps, aside from good old day syndrome, I think what it helps is we actually know when the device is making us almost feel unwell.
Mm-hmm.
And I contrast that against my kids who maybe don't have those reactions, because it's normal. It's the old thing where you don't know if your parents are crazy because they're the only parents you've ever had, right? Until you get out there and find out, even do it yourself, that maybe they were crazy. So it's interesting how this is a journey for society, as it was a journey for you, and as many of us on the outside sort of figure it out as we go.
I think you're right. I think we're right in the middle of picking up the pace on the journey. You're right. I mean, being a Gen Xer myself, I grew up in the time when you used to be able to have summertime. You go out in the morning and you'd have lunch at somebody else's place and dinner somewhere else, and then when the sun was going down, someone might holler for you and you'd come running home.
We used to be bored all summer. Remember that?
Yeah, but I tell you, I've come to really appreciate boredom, and I'm an only child, and I absolutely love some boredom.
Yes.
But watching my kids grow up, and I've got three. Been blessed with three children. I've got two girls and a little boy, and they've all grown up. Really, the two girls kind of grew up in the early years not having those cell phones necessarily attached to their hip, and I felt like it allows you to sort of unlock that creativity, that ingenuity, that curiosity you were hitting on earlier.
Yes,
really essential ingredients, I think, for pretty much anything you do in life.
100%.
And now you're seeing the overload. You can feel it. I can see it in our schools, even with my son where he's at school. They're, asking to put the phones down. They go in the morning. You don't get the phone back until the end of the day. I know it was probably rough for the first 2 or 3 days, but I think everybody it's like a collective exhale.
There's no doubt.
To get away from it.
There's no doubt. And honestly, you know what it ends up turning into? Like reading books, putting puzzles together,
That's right.
all these things that we did because we couldn't think of anything else to occupy our time. But once you put that down, then ultimately we figure out alternatives very quickly, and we find them like soothing, and lovely for our head.
That's right. So what you were kind of hitting at earlier with there being more recognition around this.
Yeah.
I feel like the constant connection to people via cell phones, potentially we're going to start getting into this. I think we're going to see more of it in the upcoming years, but even looking at just environmentally, food supply, things that are going on, all the things that continue to exacerbate the stressors in life, ultimately are leading to higher prevalence of mental health issues, which in turn is you're going to more often than not have people abusing substances. So we have a situation, I think, right now in front of us that's a problem that is needing some real attention.
Right. So the problems start, with the talk about the anxiety and the mental health, and then that leads to substance, which ultimately at certain times can even lead to a heightened presence of like suicide or things of that nature. And I apologize for any sports guy labels of that may not be prevalent in the community, but I just again, as having college age kids, you try to like understand what they're dealing with, and even the times where your son or daughter's away at college and, hey, how was class today? I don't know. I didn't even get out of bed. And it's not that they're lazy. It's that, their wheels are spinning so much that they almost can't move.
They just can't disconnect.
Yeah, exactly.
It's the thing that I notice it every day when I go home. I have a wonderful young son, and I can see it's a touchy subject for parents because it's easy to say, hey, just put the phone down and let's not deal with it. you run the risk on one hand of ostracizing them a little bit socially. So you I just feel like the communities, it's probably best attacked on a community level, coming together, families, communities, schools, allowing them to disconnect a little bit. When I was growing up, probably a lot like you, Bob, if you needed to reach me, you had to call me on my home phone.
Right.
And more often than not, mom and dad were sitting there looking at you, listening to your call. And but you were able to detach, come home from school, had a tough day, bad day, hard day, good day, whatever it might be. You could just unwind a little bit. And I think the mind needs that.
Right.
I think that's where you process. Your brain is a marvelous, God-created organ.
Yeah.
And if you allow it to do its work, which it needs some time to think, process, clear out the debris. How often, Bob, do you have a long day, you're working through issues, and you're like, you know what, I just want to sleep on this.
That's right.
And then you wake up the next day, and you think, I feel pretty comfortable about going in this direction.
Yeah, and how often do great ideas pop in our heads in the shower or on a jog or something or on a walk? It's because we literally are not distracted by anything.
100%. That's right.
So much like our lunch, we will digress and head down various trails. And while that's cool, I do want to circle back to the origin story, just from a sense of when you guys and you specifically started doing this sort of thing, what were the types of issues you saw coming through the door, regularly for the most part?
Yeah, that's a good question. I think, from the very beginning, even up until now, one of the things that I've noticed is a lot of alcoholism. Okay, alcoholism is by far the 500-pound gorilla in addiction.
By far.
By far. A lot of the opiate abuse gets a lot of the attention. You're starting to see a lot of issues around marijuana. We can touch on that here in just a minute. That's a little bit of a controversial subject, but scientifically it's pretty clear.
Okay.
But alcoholism is by far the biggest issue that I've seen. And the other one is that it affects everybody. A lot of high-functioning people that, hold good jobs. They have great families. They're functioning, but they're not really functioning. And so over the years, what I saw was people coming in just not being able to really shake the use of alcohol. They kept going back to it. They might go in and get detox somewhere or go through a traditional treatment program only to go back out and within a few weeks or months, be right back at it. And so I think with that, Bob, what I saw was people yearning for maybe a different way than what they had seen in the past.
Okay.
So when you talk about like the origins of what we do, and there's a lot of other great providers, I believe, that do it similarly. But one of our core ethos has really always been around there's got to be a better way to do this.
Yeah.
Like when I was telling you the story about the families that had lost their loved ones, that was really, it became our tagline, but it was our thought. It's just like there's got to be a better way. There's nothing. There are so many people that are out there, and this will be a touchy subject what I'm about to bring up. There's a lot of people out there that have gotten well, really working through the steps, working through AA, going through this step. Nothing wrong with it. Now, I'm not personally in recovery, but I'm a Christian. I've read through the big book. I find a lot of those principles applicable in your life in general. They can help you live a better life. We were just big believers in the early days that there's got to be more to treatment than simply working the steps. AA seems to have it has an accountability, a community aspect to it, both really, really important. I felt like the earlier days of AA was a little more religious focused, so there's a stronger spiritual component. But really what's missing and had been missing for many years, and I think programs are catching up to it now, is really incorporating the importance of addressing all the issues that are really driving the use. And when I say that, it goes back to what we were talking about. It's you got to diagnose the mental illness, because I can't remember a single patient that's come through that hasn't been suffering from some sort of underlying mood issue, disorder, anxiety, depression, bipolar, you name it. Could be a multitude of things, but it needs to get addressed.
Yeah.
It needs to get assessed, and addressed and treated. And then wrapping it around with the therapies, meaning that really goes to, you got to have, if you're going to go into a program per se and get treatment, it really needs to be one for you, Bob, that's different than one that's for me. Because our lives are completely different.
Yeah.
And what got us to where we are, being in treatment together, probably there's going to be some similarities, but there's going to be some very big differences.
Yeah.
And so you got to really personalize that treatment.
Okay, and that's how you guys have tried to tackle things with.
We've tried to be at the forefront on a couple of things. One is making the treatment as individualized as you can. And that's it's a fun word to use, but what does that really mean? It means really every aspect of what you're doing when you're in treatment with us is really geared to you, including down to the groups that you're in, the therapy. A lot of individual therapy is really needed because you've got to get down to the core issues of what's fueling it. You know, your distorted thinking, behavioral issues. There's family issues, which, by the way, is one of the biggest things that has to get addressed when somebody's in treatment, is working with the families.
Yeah.
Because that support network knows you better than we do when you come in, and more often than not, they're going to be there when you leave. And there's a lot of repair that has to be done.
Yeah.
And sometimes they don't really understand why their son or their daughter, why are they using, what's going on. I've got another child or two that they were raised the same way, but this one is acting out this way. And so including the family in there helps both from an education standpoint, but it also really helps from a therapeutic standpoint. You've got to repair the family network.
Yeah.
It's absolutely an essential ingredient.
Yeah, my first thought there, and we all have different family situations and dynamics, and some are simple and some are extremely complex in large families. And so I guess my question there would be, how difficult is it to navigate around something as simple as people are like, this guy's never going to change. You know, like change. I feel like family more than anybody are very forgiving, but family also is that's who he is. He is always going to be this way. You know, just almost, I don't want to say defeatist. Well, maybe it is. Maybe it is defeatist, but maybe that's also a coping mechanism. I don't know, but just the idea that people are who they are.
Right. I've heard that countless times over the years. I'm a firm believer that people that are excessively using alcohol and drugs to their detriment, they don't really want to feel that way. Now, they're physically dependent upon it because by using it over time and the quantities that they do, their body becomes physically dependent upon it. But at their core, I'm a huge believer that every individual that's come to us doesn't want to live this way. So that's where I think that's where the work goes first when people arrive. Some people come to us and they've hit, quote, the proverbial rock bottom.
Yeah.
I'm ready to change. I've had, maybe a spiritual awakening or a near-death experience, and I've got to do something about this. And then you've got a group of people that are not quite ready, not sure if they really want to change, maybe are being forced by outside measures to come into treatment, and that's where we go to work. Because at the core, even those really don't want to live that way.
Yeah. I was wondering, and obviously reality TV has brought some of this to perhaps, make the education process even more difficult because, we saw Dr. Drew did this, or we saw, the intervention show. And I always wondered, at the core of recovery, how much is self-motivation, required, and I guess you just said, well, it's there's cases in both directions, I suppose.
I think if ultimately you're going to have lasting recovery, I think you have to flip the switch on wanting to lean into it. Yeah. I couldn't agree more with that. I just feel like there's a process in getting certain people there. Sometimes they arrive in different scenarios, but it's like that old saying, I can lead a horse to drink water, but if they won't drink it, they're not going to get any.
That's right.
And part of our job is to help those people realize that they can make a change in their life. They can live a happy, healthy life if they really follow the process.
Yeah.
Work through these issues.
Yeah, it's I want to continue to express the fact that I'm far, far, far from an expert on this field. So I am, as we call in sports radio, I'm Joe Sixpack calling in here at times. But I will say I feel like, Dave, I, in general, am a happy person, and I have a happy disposition. Now, I get to work in sports, and so people say, oh, yeah, they pay you to go to games. I bet you're happy. And I get it. I feel very, very blessed. I can't believe that I get to do what I get to do. But I do think at its core, with regards to your approach to life, there are feelings of happiness I have that I see that some clearly maybe don't share that in their disposition, and I often wonder almost how that can be gauged in the medical community. Just something as simple as gratefulness for another day, or happiness, or and all these things, and then there are outlying circumstances, and I'm sure I'm rambling here, but I feel like there are ways to navigate life that require some sort of inner joy, and I do wonder how somebody finds something like that, because I think everything we're describing is some form of unhappiness or discontentment, and
right.
and therefore the knucklehead on the street corner would just say, be happier, and it's not that easy, So this is where I have a personal disconnect, is because I do think I don't quite understand the feeling of hopelessness or sadness or things of that nature, and I'm sure every human experiences it over time, and that's why I try to be empathetic to what I don't know.
I hear you loud
How's
and
that
clear.
for a 2-minute rambling?
No, I actually, you make a lot of sense in the way you described it, because I think people that, generally speaking, really don't have any sort of mental health issues, it's hard. You can be empathetic, but it's hard. You're more sympathetic than probably empathetic.
Yeah,
right.
yeah.
It's hard to really
That's right.
appreciate it. And that's what I say. Like, treatment's complex because what's making someone feel overly sad? Like, I just can't. I don't have any motivation. I don't want to get out of bed today.
That's right.
I don't want to engage in life very much. Or on the alternative, it's just they're highly anxious. They're fearful all the time, having trouble really controlling these symptomatic feelings that are really more mood-related issues. It's like, well, what's really going on there? And that's where the complexity is, because it's not just talking to somebody saying, you don't need to think this way. You need to think differently.
Yeah.
Talk therapy is a part of it.
Right.
And that's where we call our therapists wizards, and I think the therapists all across the land, they really are. They're like little wizards, because when I watch them intervene and make that connection with a patient,
Right.
and to where they can get in that room, i.e. between the ears, and go to some areas of that room that patient doesn't really let anybody go into, then they can shine a light on some things.
Yes.
That sometimes is hard for that individual to see.
Because we as humans, the best way we deal with problems is to build these huge walls and not even recognize them, right?
I totally agree. And you just develop these patterns of thinking that sometimes originate from early childhood.
Yes.
And it can be distorted thinking. And having an objective person that's well trained in this, that's important. You got to have somebody that's a master of this.
Yes.
They can shine lights on things and help you see, hey, you're thinking about this the wrong way.
Right.
And you combine that expertise, say unlocking those rooms, getting in, shining lights on things that patients need to see in terms of how they can change their way of thinking, giving them the tools they need to, be effective in situations that may make them depressed or anxious or angry or everything in between. And then you bring in the physician care, which is instrumental. It's a smaller amount of time that's with patients, but it's maybe arguably equally as important, because sometimes you have a fire going on in your head. I call it, you're overwhelmed, You're overwhelmed with symptoms. You're overwhelmed with feelings, which that's the fuel, right, that drives people to use. If you can calm that down,
right,
which is usually going to be some form of medication therapy,
yeah.
which is in the addiction field. When we first opened, that was kind of heresy. Why are you giving medications to patients that use drugs? And it's like, well, you need to deal with the underlying mental health issues. Otherwise, they're going to be white-knuckling their sobriety.
Yeah.
They're just living on a razor's edge.
Right.
Here. So by being able to use effective medications, proven over time that work, that are suitable for patients that have a propensity to maybe engage in overuse, right?
Yeah.
Not all medications for mental health purposes are right for people that suffer from addictions. You want an article today in the paper talking about the overuse of Xanax and different types of benzodiazepines and how if you get them in the hands of the wrong people and they can overuse them, coming off of them can be incredibly detrimental. So having that expertise combined with the therapy, and then most importantly, it takes time.
Yes.
Like we've hit on, I feel like, in this conversation is the complex nature of it. It's not something that gets remediated in 4, 5, 7 days, 14 days. It takes some time.
Right.
And sometimes on the front end, that's not what patients or families want to hear. Because we live in a society where if you want to get something, I can
just
DoorDash your lunch in just a minute, or I can have Walmart deliver something later today.
Right.
Dealing with this issue is a process, and it's a journey. But like anything in life, I think a good journey is what's going to lead to probably a good outcome here. But it's complex, and because it's complex, it just takes time.
This is really fascinating to me because I think at its core, this is a society-built problem that we're actively, especially us media folk, I almost feel like we're making the problem significantly worse all the time. I think people that watch way too much cable news, I think people that scroll way too much and the doom scrolling, I guess, would be that, basically the premise is what gets attention, whether it be on a TV screen or on a phone screen, is extreme ideas about how we're all going to die a terrible death, right? It's a war is coming, or the Cowboys are always going to stink, or the economy is crashing, or these people are trying to hurt us, or whatever the case may be. And that's a media-driven thing because it gets good results for the media. It certainly gets eyeballs and clicks and money. And I think when we dig down just an inch, we find that actually the detrimental problems that it's bringing in society, or at least maybe not bringing, but multiplying. May I say that?
Right, absolutely.
I feel like they're all connected to a point where even in the last 10 years, the growth of the problem is probably significant enough that we probably all need to have a talk.
I agree, and this is it's a big issue. It's a worldwide issue, but if you look at our country, it's significant.
Yeah.
So how do you attack things like this on a macro type level? I think at the end of the day, you're going to be doing it in communities, and at the very end of the day, it's probably going to be happening in family units.
Right.
And so I tend to in my mind work my way out from there. Is that the more informed or intact these family units can be around issues of mental health, addiction. And then they're going to be better prepared to deal with their loved ones that may suffer from these issues. And so, just going back to the very beginning of what we've been talking about, is like one of the overriding purposes of just us doing this podcast is we want to have real, authentic, and at times it should be debatable, but controversial types of outlooks on how you really get more effective in the treatment industry. Mm-hmm. And in the process of doing that, we're going to bring some of the leading thought leaders in a variety of areas of therapy, trauma resolution, brain science, neuromodulation. And then one of the big areas that we'll probably touch on as we're ending this is really around the area of functional psychiatry and looking at the interrelation of how what goes on in your body actually is impacting your mind.
Yeah.
In my opinion, that is the next frontier of psychiatry that our field needs to move into.
Mm-hmm. Yeah, that's very interesting. So from a standpoint of, again, going back to the types of people you see and you guys help, Is it in a family? Is it normally, because we've kind of gone in two separate directions? I wanted to see, the split here. Are we talking about dad or mom getting help to sort of, our family's deteriorating, and it's probably this cause is at the core of it, or is it, we've got a kiddo here that's going through some things that we can barely relate to because we didn't grow up in this time, and so we're trying to reach out to our high schooler or our college age or a young adult or whatever. So what do you see more of there?
Yeah, that's a great question. We actually spent a lot of time this past year. Just over the last 17 years, we've treated thousands upon thousands of patients, and we've tried to just say, okay, if you were going to compartmentalize the categories, where do they really fall into?
Yeah.
And this is, generally speaking, and it's just a general statement,
Sure.
but you typically have the young adults, let's call them that. And we typically treat adults. There's adolescent therapists out there. We don't go into that.
Mm-hmm.
But, so from an adult standpoint, young adults, let's say anybody that's probably 18 to mid-20s,
Mm-hmm.
that's a segment. And they've grown up in a little bit of a different generation than you and I
To say
did.
the least.
Yeah, and they have different influences.
Yeah.
And often there's experimenting with different substances,
Right.
by the way.
Right.
Marijuana being one of them at the absolute heart. It's all over the place. It's
Yeah.
kind of almost supplanting the use of alcohol.
Mm-hmm.
When we grew up, you'd maybe go to a field party and people would sneak around alcohol. And there was some marijuana use, but a very different type of marijuana that's being used today. A lot of the synthetic materials that are in the marijuana today, and our lead doctor, Dr. Urschel, just spoke on this at the Center for Brain Health last week. It is causing absolute chaos across the land.
Really?
Oh, absolutely. We see it every day. A lot of psychosis in patients that are using today's form of marijuana. You got to be very, very careful with it. But going back to that group, that's a segment. I'd say kind of the young adults. And then you've got let's put them into a big category, sort of that 30 to, say, mid-40s. Okay. And in that category, you've got people, they're hustling, right? You got probably dual working families.
Yep.
You got kids. You got responsibilities. You're trying to figure yourself out at the same time as you're raising these kids. A lot of stress.
Mm-hmm.
A lot of things that maybe went on in your life when you were younger kind of start coming up out of the soil, and you see them. So there's that use. There's that category. And right there is where it's real important with the family is often there's marital strife. There could be a lot of infidelity. There's a lot of issues that come to the table.
No doubt.
Plus, you've got children involved. And so being able to repair, I don't know if repair is the word, but being able to help that person heal so that they can be the father or mother they need to be for their family, absolutely essential.
Yeah.
And then beyond that, I feel like you start to get into that kind of 50 plus. And in there is a variety. I've noticed over the last several years, really since COVID, because I think COVID actually forced a lot of people that were sort of on that maybe younger end of the baby boomer generation
Mm-hmm.
to start to look at, do I retire? I just go home. A lot of people, just went home to work. And in that period of time for those older people, they lose a little sense of purpose,
Mm-hmm.
if you will. And, I'm a big believer. I was raised this way through my family. I just think work's almost like an essential ingredient of life. You don't have to maybe do your 9 to 5 till you're 95, but I think you got to be doing something.
You have to have a purpose.
You got to have a purpose.
Yeah.
And I've noticed with, some of that older generation, usually maybe grandparents.
Mm-hmm.
So often kids will call us and say, our dad isn't doing well, or our mom isn't doing well, or one of them passes and the other one starts to suffer. I guess in the whole, when I describe this, what it makes me think is it doesn't discriminate against anybody. There's just unique situations to each of those age groups.
Yeah.
So we have to deal with those a little bit uniquely, because the 75-year-old that's retired and maybe lost his wife and is estranged from his kids and has no sense of purpose is in a much different situation than the 22-year-old that just dropped out of their junior year of college, and they feel like they're disappointing their family, and they're not even sure if they really want to live a life free of sobriety because all their buddies are doing it.
Right.
Very different situations. That's why being able to get in and treat each one as the individual that they are is absolutely paramount.
Man, you hit on so much there. And what I think about is having a purpose. And then the opposite of that is feeling like you've failed or you've let people down, and you don't want to let people down, and so you look for another escape, and that affects so many people's lives. But really, again, another. And I guess we're finding out that I am affected. I resonate with little cliches, little sayings, and maybe that's why they're so effective in life, and maybe even on commercials. But for me, whoever said our society has never been more connected, at the same time, people have never been more lonely, seems to kind of be a different way of saying this, especially with those young people, right?
I think it's true. I've tried to, even with my young ones. We yearn for personal connection.
Yes.
And texting your buds and things like this, it serves a role. But I still see, even in my college age kids and the young kids, they want to be together.
Mm-hmm.
I don't think that's something you can take away from them.
Right.
You just have to help educate them. I mean, I don't know if this is a trend that other people are seeing, but I'm noticing it even with my college-age girls, is they went through that period of, the Instagrams, the Snapchats, and all this being constantly connected, going through COVID years, only to get to this point in their life where they're in their young 20s, and they're realizing, I need to have a little space with this.
Mm-hmm.
And I really want to have some meaningful personal connection.
Right.
So, I'm a glasses half full type of person. I believe that we may go through some rough troughs, but they may serve a purpose. And I think you might find this younger generation to be maybe a little more informed. Like I'd love to have this dialogue with you in about 20 years and talk about what those young 20s are like as parents.
Yeah.
Because they might raise one of the better generations we've seen.
Yeah, with an emphasis on like community and connection and all these things that, as humans, we probably underestimate the worth when we have it. And then when you're in isolation or, I guess the lessons COVID taught us again, but just it feels like basically the fresh air of life is just, as a parent, I can't tell you how important this was to me. When our kiddos were young, was just the idea of almost comparing notes with somebody else over dinner, and you're not at dinner to do that, but invariably, hey, let me tell you what's going on in our house. Oh yeah, and before long you're like, wow, my kids are totally normal, and I guess these are the life lessons that are important for all of us. But I just think that the path you guys take is so vital as we see these problems continuing to escalate, and the idea that there are solutions for people. There doesn't need to be hopelessness, because that's the key to life, right? Don't ever believe that we're down to 0% hope. There's always hope.
Always hope.
Yeah.
No, and I think that's one of the things we've always wanted to try to get across, is that addiction is treatable. Mental health is treatable.
That's right.
It's not something that, it may be chronic in nature, right? If you want to put that label on it, meaning it has to be something that you've got to learn to manage over time. But I think that's kind of life, right?
Yeah.
We all learn to manage different things. We're all unique. I mean, as we get older and you develop relationships with people, you tend to be a little bit more vulnerable, I feel like, as you get older in life, because you develop different types of relationships, and you realize everybody's dealing with something. And I think in the addiction and mental health field, it's just raising some awareness around this, getting the right treatment, lots of great treatment out there. Again, through these series of podcasts, what we're going to try to do is really shed light on important things we want the community to be aware of.
I love it.
How do you discern what's really good quality treatment? What are some things that you might want to ask your provider about? And also hopefully shed a light on where we're going. Where is treatment leading into the future?
Yeah.
And what are some advancements that could be on the horizon? You brought up something in the very beginning that I've I was taught as a young person, I still believe in it today, is a curious mind is a great mind. And I think we have to be curious about and not be stuck in our ways because, again, the field of mental health and addiction is one that I still feel like is almost like the last frontier, the mind. We don't know a ton about it, but we're starting to learn. And even today, in today's world, you can feel us moving beyond, okay, in psychiatry, historically, it's really about treating symptoms. It's symptom relief. You go see a psychiatrist, he's going to listen to you. He's going to use his experience and the years in the field. He's going to categorize you into some sort of diagnostic category, and he's more likely than not going to give you a prescription of medications. And for those that have gone through those situations, sometimes the first one or two medications don't always work, and there's a lot of side effects with it.
Yeah.
It's about symptom relief. Nothing wrong with it. It's actually been the gold standard for many years is great therapy combined with psychiatric treatment is where you're going to get the optimal results. The next frontier, I think, is understanding that the mind is connected to the body, at least for most people that I've met in my life.
Yeah.
And there's a lot of interrelation there. And understanding your unique biochemistry and how that affects the way you feel, to me, is true root cause treatment. Really understanding the root cause of your symptoms. And there's going to be a role for Western medication, role for traditional psychiatry, but making it hand in glove with some of these advancements that are coming, which, by the way, is really the old school way of doing practicing a doctor. It's just, it's now going to get its opportunity to shine.
Let me ask you one question that may be not the most intelligent ever in this field, but I'm going to take a chance here. How much of that sort of thing, especially from a standpoint of like anxiety and depression and mental illness and so forth, how much of that is genetic? Because in sports, we explain a lot of things by, hey, congratulations, you had an all-state dad. There's a pretty good chance you're going to be able to play sports at an all-state level, that sort of thing. But does that sort of thing also... is that passed down? Is it familial?
100%.
Okay.
100%. Genetics plays a role, but again, I think we're still learning to understand.
Yeah.
What are the defining characteristics of the genetic part? But does genetics play a role in mental health? 100%.
Okay.
Yes.
Fascinating.
Yeah, and I think being able to understand that can help you with some preventative issues for those that know that maybe they have a genetic history of this. It helps knowing that. But also the genetic part also plays a role in understanding how your body may react to certain types of medications. So it plays a role in understanding what medication would be better for you versus one that might not work based on your genetic profile.
And is there almost a cutoff age where something like medication for that, for depression or anxiety, is there an age where it became at least more accepted and normalized, or is that still a battle that goes on every day with the eye rolls and because it's a real thing. I've seen its effects, I've seen it work, and at the same time I do know that when you step outside the door and start surveying people on the street, you will still get eye rolls at certain points.
Yeah, I feel like you're a Gen Xer. Well,
yes.
Yeah, I think we're the last generation that is doesn't want to talk about
absurdly cynical about everything.
Yeah, you don't want to talk about this with our generation or people older than us.
Yeah.
Generation below us, they're actually remarkably open about it. People I work with,
probably
people
because
I know.
See it everywhere more, right?
Yes, and I think that stigma has got to go away.
There you go.
If you're going to really be effective on this on a grand scale, we got to wipe the stigma away. It's nothing to be ashamed about because you can get your life back together.
Yeah.
And it works.
That's fantastic. I'm very interested in where this podcast goes. I'm thrilled to be your least learned guest as you go here, and I'd love to circle back once you guys get going here, and And because, again, I do think one of the advantages I have is trying to learn about things I know very little about. And even a conversation like this takes me to a place where you've connected a lot of dots for me. As my scrambled brain, I love to read, and I love to try to understand things that I know nothing about, and sometimes I'm successful and sometimes not so much, but it doesn't keep me from trying every day.
I think it's a great attitude to have, and it's one of the things that we talk about all the time just in our company, as we don't have all the answers, but what we do have is a deep hunger and curiosity to keep marching towards what could help our patients.
Yeah.
It goes back to that mantra in the very beginning, there's got to be a better way.
Right.
I don't think you ever go through this process and feel like you've got it all figured out. And so again, talking about this podcast, that's what we're going to do. We're going to push the status quo. We're going to bring great thinkers in.
Yeah.
And we're going to talk about these issues because there's still a long journey here.
Right.
And
it's not a recipe.
No, we're saddled up and ready to go.
It's an individual situation for so many that are dealing with stuff. So go get them, man. This is awesome.
All right, Bob. Well, this has been a pleasure. I really appreciate you being on our first inaugural podcast, and feel like I'm with the king here, so hope I did okay.
Well, I loved it, and talking into a microphone's easy for me, but always knowing what I'm talking about is where it gets tricky sometimes. So this has been fun.
It's been great. Thank you.
My pleasure.